I'm here to do your physical assessment. Can I read your bracelet? Can you go ahead and verify your name and date of birth?
Elva Hernandez, 9/24/66.
Okay. And the tech already did your vital signs, so we're okay to start. First, I'm just going to start by inspecting, kind of palpating around your scalp. I'm checking for any abnormalities, any lesions, scars, or any skin breakdown, but your scalp looks really good. Okay. Next, I'm going to check your sinuses. Tell me if you feel any tenderness. This is your maxillary, your temporal. Any tenderness?
No.
Okay, good. I didn't feel any fluid either. Okay. Now I'm gonna move on to your eyes. Go ahead and look straight at me. Okay. I'm going to check your conjunctiva. That's nice and pink and moist. Now your sclera. It's nice and white and moist. Okay, go ahead and look at my pen. Follow the pen. Now look at the wall behind me and look at the pen. Good. So I see that your pupils are equal, they're round and reactive to light, and they accommodate. And we've already checked your cranial nerve number 2, which is your optic with the Snellen chart, and your vision was 20/20. So that's good. Okay, I'm going to look at your nose now, and I'm just checking, making sure it's symmetric with your face, and it looks like it is. And I'm going to check for no deviated septum, so go ahead and... Okay. Your mucous membranes are pink and moist, and they look good. Go ahead and look back down. I'm going to check your patency. I'm going to close one of your nostrils and go ahead and sniff for me. Okay, now the other side. Okay, so that indicates that there's no blockage, so it looks really good. We're going to move on to your mouth. Go ahead and open wide for me. Okay, lift your tongue up and down, side to side. Okay, good. And I see that your gums are nice and pink. I don't see any red lesions. Your uvula and your tonsils are intact. Your teeth are nice and white. Your lips are pink and moist. So that looks good. Okay. Now I'm going to move on to your cranial nerve number 5, which is trigeminal. And I'm going to need you to close your eyes and tell me when you feel me touch you.
Yes. Yes. Yes.
Okay. Now we're going to check cranial nerve number 7, which is your facial symmetry. Go ahead and smile real big for me. Puff out your cheeks. Now raise your eyebrows. Good. Everything looks symmetric. I'm going to move on to your ears. I'm just palpating. Any tenderness?
No.
Checking for lesions. They look good. Now I'm just going to check inside for any discharge, which I don't see any. Okay. And I'm going to check your cranial nerve number 8, which is your hearing acuity. So go ahead and cover one ear for me and repeat what I say.
1, 2, 3.
Okay, now cover the other one.
10, 9, 8.
Okay, good. I'm going to move on to your neck. Checking for your trachea. Make sure it's midline with your body, and it is. And it looks good. I don't see any masses as well. Your thyroid all looks good. Okay, so I'm going to check your carotid now. And I'm checking for bruits, and I don't hear any. If I was to have listened to a bruit, it's an indication of stenosis, which means that there's a blockage or narrowing in the vessel, which I don't hear any.
Okay.
So, sounds good. Now I'm going to move on to cranial nerve number 11, which is your spinal accessory. I'm going to put my hands on your shoulders and go ahead and raise your shoulders up for me. Now back down. Okay, I'm going to put my hand on your face and try to turn your face towards my hand. Okay, now the other side. Okay, looks good.
Excuse
your anterior thorax. Okay, and I'm just gonna palpate, and I'm checking your skin, making sure there's no moisture, checking the temperature, it looks good. And I'm checking that your skin color is contrary with the rest of your body, and it is. So it all looks good. I'm going to go ahead and auscultate your lungs, and I'm going to check on about 5 sides on each one. Go ahead and just breathe normally. Okay, your lungs sound clear. I didn't hear any wheezing or bronchi, so they sound really good. Now, do you normally do breast exams at home?
No.
Okay, it is recommended that as women we do breast exams monthly, and it is recommended to do it once a month. Usually the first of the month is the best because it's the easiest day to remember. So now I'm just going to show you, and if you follow me, I'll show you how you can check for the breast exam. Okay, go ahead and start at the axillary muscle. You're going to do it in a circular motion. So you're going to go all around your breast in a circular motion until you get to the nipple. Once you get to the nipple, you're going to squeeze, and if at any point you have discharge, make sure to contact your physician immediately.
Okay.
Okay? Alright, now I'm going to check the pulses. I do see visible pulses. Look good. Okay, I'm going to listen to your valves. And your heart is usually located on your 2nd to 5th intercostal space. Okay, I'm listening to your aortic valve, which is on the right 2nd intercostal space. Now I'm checking your pulmonic artery, which is in the 2nd left intercostal space. Now your Erb's valve, which is in the 3rd intercostal space. Tricuspid valve, which is in your 4th intercostal space. Mitral valve, which is in your 5th intercostal space. And while I'm checking this, I'm going to check your apical pulse. That is in the 5th intercostal space, and it's mid on the clavicular bone. So it's right on women, it's usually underneath the breast, so you kind of lift up your breast and you check there. Okay, your heart sounds good. I didn't hear any murmurs, and it sounds really good. Okay, now I'm going to also check. Go ahead and breathe in for me. Okay, good. I did see that your lungs expand symmetrically, and I didn't hear any wheezing, so they sound good. I'm going to move on to your back. I'm going to check the spine, make sure you have no scoliosis, kyphosis, and I'm checking your skin, make sure there's no skin breakdown, checking the temperature. I don't see any moisture, edema. Your skin color is contrary to the rest of your body, so it looks good. Okay. Go ahead and take a deep breath for me. Take another. Okay, your lungs do sound clear. And I didn't hear any wheezing as well. Now I'm just going to go ahead and auscultate your lungs. Go ahead and deep in breathe for me. Just continue to deep breathe normal. Okay, and normally we auscultate about 9 sides on each lung. Okay. check your upper extremities. Go ahead and extend your arms out for me. I'm just checking your skin, make sure there's no skin breakdown, no lesions. I don't see any moisture, no edema. Your cougar is good. That means you're well hydrated, so that's good. Now I'm going to check your capillary refills, and they blanch in 3 seconds. Okay, that's good. Okay, wash your arms. Now I'm going to check your pulses, brachial pulse, radial pulse, and I'm going to check those on both sides of your arms. Now I'm going to check your deep tendon reflexes, your brachial radialis. Okay. I'm going to check your neurological sensations. So tell me, close your eyes and tell me if you feel it's dull or sharp.
Sharp. Dull. Sharp. Dull.
Okay, and we would check that on both sides of the arm. Now I'm going to show you some range of motion. You abduct your arms. You're going to flex and extend for me. Flex, extend, go ahead and reach back. Okay, now abduct back to your body. Okay, it looks good. Now I'm going to have you lay down. I'm going to check your abdomen. Okay, take a deep breath in for me. Okay, I'm just checking that your skin is contoured. I'm not seeing any masses, any lumps. So it looks good. Go ahead and breathe normally. Now I'm going to auscultate your abdomen. I'm going to check the 4 quadrants. I'm checking for vowel sounds. I'm going to start with your lower left, upper left region, upper right quadrant, lower right quadrant. And sometimes that can take about up to 5 minutes to listen for a vowel sound. And I did hear a vowel sound in every 4 quadrant. If it was loud, that usually would mean that your vowels are hyperactive, or if it's low, they're lower absent, they're hypoactive. So, but yours sound really good. I'm going to move on to your lower extremities. Okay, I'm going to check your pulses first, femoral pulse, oblivion, your Achilles, and your dorsal pedis. Your pulses are good. I'm checking your skin for any lesions. No edema in your legs. That's good. I'm going to check your deep tendon reflexes. Oblivion. Achilles. Plantar. Tendon reflexes were good as well. I'm going to check the neurological sensations on your skin. So go ahead and tell me if this is sharp or dull.
Dull. Sharp. Dull. Dull. Dull.
Okay. Sounds good. Now I'm going to have you raise your leg and we're going to bend it. That is flexion, extension, flexion, extension. And you have really good muscle mass.